Hi, and welcome to Mind Your Body. I'm Stephanie Stevens. So you've been to your doctor, you're in pain, and he's told you you need surgery, but that's not an option for you. Dr. Moshe Lewis is here today with me, and he's a pain management and rehabilitation specialist. Dr. Lewis, I've had fun researching alternative methods of controlling pain, and I came up with a list I'd like to talk to you about, beginning with epidurals. When I hear that term as a woman, I think about controlling pain during birth. But epidurals are used for other reasons as well.
Exactly. Epidurals are an excellent way of injecting a little bit of steroid into the spine to deal with pain that's in the back, going down to the legs or even down to the arms. And it's a procedure that takes about 5 minutes. Just a little bit of steroid goes a long way at alleviating pain in the arms or legs.
This was new to me as well. What are nerve and facet blocks?
Now we're going a little deeper into the spine. In between the bones of our spine, we have 31, you actually have joints. And sometimes those joints hurt. Those are facet joints. So again, we put just a little bit of steroid and a little bit of anesthesia in between those facet joints. And when you're moving, it helps decrease the pain.
Here's another one. This was brand new. What is a TENS unit? T-E-N-S.
Exactly. So that stands for a transcutaneous, across the skin, electrical stimulation unit.
Of course.
So essentially, you're just putting a patch with a little bit of electricity that the patient controls, you control it, and it helps decrease the pain that may be in a joint. So it's essentially a way of using electricity to decrease our pain, essentially by distracting or tricking our brain.
How common is the use of viscosupplementation? And I think you'd better explain that one as well.
Sure, these big words, but this has been around since 1984 and we've done tens of millions of them. The visco just means that the lubricating medication, in this case, goes into a joint, usually the knee, and it actually helps the knee to actually, almost like oil, not feel so stiff. So I often explain it as a lubricating ointment or a lubricating medication that makes our knees move without so much pain, often due to arthritis.
This sounds very high-tech. Radio frequency ablation. Does it hurt? What is it?
Sure. So now we're actually burning the nerves these days, and they do actually regenerate or sprout. But many times pain that's going down a leg especially or an arm doesn't respond to an epidural that we discussed before, and ablation is a way of quieting that nerve pain.
Finally, what about pain pumps? That sounds pretty serious.
Sure. Often near the end of the road, we've really tried to give patients a medicine or tried injections and they haven't worked. And if they're taking a high dose of medicine, a pain pump is a way of essentially having a portable unit that you can carry around. It's very small, it is put inside the body, and it delivers the medicine. The biggest advantage of this is that it's very, very low dose so that people don't get sick from taking pills all the time.
Well, it sounds like when life is a pain, no pun intended there are lots of choices in addition to traditional methods that give patients a lot of hope. Thanks for explaining those to us, Dr. Lewis.
Sure, thank you.
And thank you for joining me on Mind Your Body. I'm Stephanie Stevens.